Everybody, Chad Madden here with the Grow Your Practice podcast. And in this episode, we'll be talking with Mark Callanen. Mark is not only a physical therapist, he's also the Director of Marketing and Clinical Research for Chattanooga. If you've been to any of the breakthrough events, you've also seen him with LightForce, DonJoy. It's all part of one big happy family that I'm going to let Mark explain to us exactly what that means. But welcome to the podcast here, Mark.
Thanks, Chad. Yeah, we, as many of you now know, we were LightForce. When I say we were acquired by DonJoy / Chattanooga in December of 2020. So as of 2021, like we just alluded to, we're one big happy family. So there's a lot of brands that are involved. DJO is kind of the parent company. Chattanooga is that trusted partner that I'm sure many of you have a piece of that equipment somewhere in your clinic. Classic tables, hydroculators, things of that nature. And then, the desire was to sort of let's start moving into a higher tech side of the rehab space, which is why they looked into grabbing LightForce and as well as Shockwave technologies, which are great for handling soft tissue problems and chronic tendinopathy. So my job is to help explain how that stuff works for the average clinician so that they know how to put it on a patient and get a great outcome. So, yeah.
Great. Yeah. One of my quick share, one of my first large purchases was a high-low table, Chattanooga high-low table. Mark, it was being a manual therapist, and I believe this was 2007, 2008. And I just remember how much it was saving my back, my knees, my hips, and everything else, just having this high-low table, and how proud I was when that was delivered. It was great. So a couple things to talk with you here about, but I think what is most timely right now for those of us in private practice in general is this Medicare cut, declining reimbursement that we're facing here in 2022. And I know when I'm talking with private practice PT owners, functional medicine, chiropractic, podiatry, et cetera, and they're looking at that downward pressure, we also have the upward pressure because there appears to be significant inflation in the last 12 months. We have upward pressure on employment expenses, space expenses. I know now for us to look at a de novo clinic to build out, it was $50,000. Now it's $150,000. So construction costs have tripled. So we have that upward pressure, and we're constantly trying to balance, our profitability. And I know many of us, especially in the PT world, we just kind of write off cash pay services. It's against our nature a little bit. And I know, in our experience working together, specifically with LightForce and LightForce Laser, implementing that in here, gave us a $6 per visit bump in terms of a cash pay rate, which was very much needed as we're trying to mitigate everything for next year. So my question to you is, how do you see practice owners planning ahead for 2022? And how are they planning on using the cash pay services? You mentioned Shockwave or LightForce lasers, et cetera, in terms of mitigating that decline.
Yeah, so just to be clear, I think, Chad, when you say a $6 increase per visit, that's across the board for your net revenue per visit. So it's not that you're charging $6 for the laser. Is that correct?
That is correct. That is an average increase in revenue per visit for the 20,000 or so clinical visits we see each quarter.
So for those managers, owners out there that are, scratching their head to just try to increase that number by a few dollars, which is not an easy thing to do, a heavy, hitting device program like a laser or dry needling or Shockwave can really help move the needle in that because of the outcomes it can generate. But it's important to understand that, because I hear it all the time. People start thinking about, I want to implement a program, and the first person that will come to mind is that patient that is not wanting to purchase a piece of TheraBand from you, and they're like, don't want to make their copay, and they're like, there's no way I can do this with everybody. And the nice end of the story is that everybody doesn't have to do it. It's not for every patient. It's something that you're going to recommend and offer to your patients on an as needed basis. And the people that you feel are good candidates, you're going to explain why that they are good candidates and why it will help them, and then let them make the decision. So I'm sure we'll get into more of that here down the road. But I would just say that's a mental block that a lot of people have as soon as they start thinking about a program, is that they have to be able to wash it over every patient that walks in their door. That is not the case at all. The nice thing when you start talking about laser, for those of you that don't know, it's impacting cellular metabolism. So it can really help almost every patient that walks in. If you have somebody that's coming in with pain, laser is a good choice. It's going to help. And Chad, I'm sure, can tell a few stories about some people that he's worked with and how quickly it can move the needle. And that's really the power of high power laser in the outpatient setting, is that you can move pain needles by no joke, 50% or more in a 3 to 5 minute treatment, depending on the equipment you have, which is a super powerful tool. So you want to tell a story or two, Chad, that backs that up? Or
Yeah, absolutely. So 2017, I'm thinking it was April, we were in San Diego. It was the first time that I had met the LightForce team. And I had, when I was sick, had flu-like symptoms. It was pretty rough because I think we had like 260 odd people registered for the event. It was brutal. And so had that. And then I think I fell asleep on the plane and had pretty wicked left-sided neck and shoulder pain. And I remember talking with the LightForce team, and they said, well, let's do a treatment. And we recorded it. And there was an immediate effect. Not only, did my pain diminish, I think I had said on the video that I was like a 7 or 8 out of 10 down to a 2 when I was rotating to the left, but I also had a huge improvement, nearly doubled my range. Then the co-founder of Breakthrough, Carl, also at the event, was having back pain. And this is what really did it for me. So not only did I feel it, but I had treated Carl, and it was a lumbosacral issue. It was chronic, and he had basically eaten dirt while he was surfing the week before, and was having a lot of trouble. So I'm trying to move him. He was super limited in flexion, couldn't even get to his patella, couldn't touch his kneecaps. And it was I think a 5-minute treatment with the LightForce, and then literally he touched the ground immediately after that. And I was like, wow, there's something to this. Is there research? So I know you sent some articles over. I think 1 or 2 of these I had read before, but can you talk a little bit, and let's just stay on laser for a second. Can you talk a little bit about how, what's going on? Yes, it decreases pain. Yes, it increases healing rates, but how's it doing? What's going on with laser?
Yeah, so there's sort of 3 buckets to think about, and we'll get back to how this all relates to you making a few extra dollars in your clinic. But I think it's a good point that Chad brings up. Let's really understand some of the mechanisms. So if you can just think about inflammation, tissue healing, and pain as sort of 3 separate buckets, it has the ability to impact all these things. So from the pain standpoint, the thing high power laser can do, which is a little bit more unique than if you're familiar with using class 3B or lower power lasers. They've shown in the recent research that if you get enough light energy, or what they refer to as a radiance, which is truly a power density, watts per centimeter squared or milliwatts per centimeter squared, on a peripheral nerve, you can actually slow down conduction velocities, compound action potentials. You can reduce the pain signal that's coming from the site. So you smack your hammer on your thumb, it hurts. You treat the thumb and the nerve path from the thumb up to your neck with the laser, and you're essentially slowing down that message. So it's pretty cool. And what they show when you look at a light micrograph, if you took a peripheral nerve and shot lidocaine on it, you get all these little changes, these neuroplastic changes that they call varicosities that form. And the cool thing is that when you splash enough light on it, the same neuroplastic change takes place. They look very similar, which is pretty interesting. So you can get different stimulus that creates the same sort of change, and they both have an impact on the nerve's, pain telling story. So from that standpoint, that's one of the real powerful tools that you can gain in your outpatient practice by having a high power laser, is that you can truly create analgesic effects that will last anywhere from 18 to 36 hours, depending on how superficial the nerve is and how much energy you put in. But when I say that, almost always clinicians go, oh, so it's a short-term sort of parlor trick, right? But the nice thing is that beyond that, it also is helping with general inflammatory issues. So it has the ability to impact a lot of different intermediaries in the inflammatory cascade, which can quiet down inflammation pretty quickly. So you have that swollen joint, that's post-surgical, or they just sprain an ankle. You can treat them with the laser with the right dosing, and you'll notice significant changes in that edema within hours. And, sometimes, we have a lot of these LightForce products in the pro and Division I college settings. And I don't know how many of you have watched, an athlete go down with a sprained ankle, and you think about what you see in the clinic normally, and you're probably thinking, oh boy, that's going to take 2 to 3 weeks to get that person to be able to possibly practice again. And then lo and behold, you'll see them on the court playing 3 days later. So part of the magic on how they do this is having devices like the laser that can really accelerate that healing process, getting them from that inflammatory phase into a proliferative stage much quicker because of its impact on the mitochondria. So at the basic mechanistic standpoint to Chad's question, is it has the ability to impact mitochondrial function. So basically it's tuning up and turning up metabolism in the cell, which allows more ATP to get produced, which allows a lot of different things to improve as far as the cell to divide, for fibroblasts to lay down more collagen, a lot of different things with the inflammatory cascade, all these things that help the body heal. So it's very powerful for the use on strains and sprains. Get that tissue to basically rebuild and scar down more healthily and stronger. They've done studies where they've looked at hamstring strains and treated it with the laser, and they've shown that the tensile strength is better after the laser than those folks that didn't get treated. And it's just due to better blood flow to the area, better fibroblastic activity to lay down new scar tissue. So pretty exciting stuff. And that's on the nuts and bolts in the musculoskeletal place. But I mean, when you start looking at the sort of the edges of the research with laser, they're looking at stuff flashing into the brains, things that are cortical in nature. They're treating depression, post-traumatic stress, things of that nature, and getting pretty decent results. I've just recently heard of some studies being done with kids with autism, and it's actually working. So it sounds like, oh, yeah, that's all science fiction. But when you think about it, you're just creating an impact on cells and their ability to do their job. The applications are pretty vast. So you're only going to hear more and more about light-related therapies as time goes on, because they're starting to see, it's not so much a matter of does it work now, it's just a matter of what's the right dosing, what's the right parameters to make it work for that tissue type. So it's pretty exciting to see what's coming out.
Awesome. So yesterday I was having a conversation with a friend. She's coming in. She has long-term knee osteoarthritis. She's seeing one of our therapists here, and she just by chance happened to say, hey, by the way, when I do the laser before therapy, my treatment goes a lot better. And and this is somebody who literally is on the verge of surgery. So yes, we're doing all the manual stuff. It's in the research, meniscus reduction. She's having pelvic mobilizations, all that. And so this is coming from her. She said, hey, by the way, what is the laser doing? Now, I did not go mitochondrial excitation. I started to say photobiomodulation, and then I just, I took a big step back. But yeah, just, and I was like, I was trying to explain, what was going on, but I said, basically, it's exciting the cell and speeding up healing. So right now, Mark, you just had mentioned, primarily in acute care or in acute injury settings is the main thing. Before we get into shockwave and chronic tendinitis, or and we're talking about that, or tendinopathy, can you quickly, just for everybody, clarify the difference between cold laser, which is everywhere here in central Pennsylvania in terms of our competition, a ton of people advertising cold laser, and the 40-watt laser that we have in our clinics, and that that you really specialize in with LightForce.
Yeah, so let's dive into that question you just had about the knee arthritic patient. So yeah. What the LightForce laser can do, or a class 4 high power laser can do, is that it has your target tissue with a swollen joint is generally the synovium. So you're trying to impact that in a couple different ways. Lots of nerves in that synovial tissue. So if you can basically create that blocking effect I was just explaining on that capsule, all of a sudden that person can bend their knee a lot easier with a lot less pain. So that can really lead to some pretty dramatic functional change for a session in the clinic, which is a huge win. The second piece is going to improve circulation in that synovium, which is going to help with just the general inflammatory environment that's in that joint space. So they've shown sometimes if it's real chronic OA, it takes a handful of treatments over about a 2-week span to really impact the cytokines that are in the joint space. But it can be a great management tool for this reason by sort of bringing down that inflammatory process in the joint space to manage it. And for somebody who's really has a lot of comorbidities or isn't a great candidate for surgery, it can really help push the pause button. I read a study a few years ago where they took 100 people, 50 of them got standard therapy, the other 50 got therapy and laser. And then they looked at what was the rate that they went on to get a total knee arthroplasty. And of the group that got the laser, there was like 2 or 3, and the group that got none was like 11. So it was a pretty small sample size, but it was a significant difference in the people that had to go on to get more invasive surgery. So there is a place as a management tool for it. But when you start talking about class 3, class 4, cold laser, the term cold laser, it's sort of a junk term when you really are in the laser space. Photobiomodulation, which Chad nailed, is the accepted term now for this technology. So anything that's going to have light that impacts cells, that's the right term. If you're looking for studies, that's the right mesh header to be using. And that incorporates laser and LED light sources for this. So when you think about, well, what's the huge differentiator between the high power and the low power other than cost, because it's usually quite a bit more expensive to get a high power laser, that pain blocking phenomena that we were just describing, you have to have a lot of power density to make that happen at nerves that are even just a few millimeters below the surface of the skin. So that ability to have somebody go from, like Chad experienced, from 7 to 2 in a 3 or 4 minute treatment, you have to have a lot of power to make that happen. Now, can you make inflammation come down in a joint? Can you make tissue heal with a low power laser, to help with general circulation and impact the inflammatory cascade? Yes, you can. But that generally isn't going to be the quick, aha, that really helped. So it will help, but it's one of those, you got to trust me, it did something, and we'll compare notes in 2 days kind of thing. And we know that the impact with a patient, if you're having that discussion, it's a very different discussion than if you do something, whether it's a manipulative move or a dry needle where you get a twitch response, or provide the laser and all of a sudden you've made a significant impact in their pain today. You now are in a very different seat when you're talking to that patient about if say this is a service that has a cash dollar amount attached to it, it's going to connect dots a lot differently than if you're saying, hey, I just did this thing, let's wait 48 hours and see what happens. And I think Chad can probably speak to that with his staff, with what he sees. You don't have to be a genius and to apply these tools, but once you understand the basics of dosing and how to apply it and how to set power and what have you, you can regularly get these really nice results from a visit or two. And it can really change the conversation when you're talking about cash, for that service.
Yeah. The quick note that I had here was just to talk about indications. So far, we've mentioned knee OA. We have seen it work very well in many acute pain cases. Also, we've used it on chemo-induced neuropathy with a very high success rate. And again, this was a family friend who had reached out, who had heard that we had the 40 watt, the high powered laser. And she had done the research, pancreatic cancer, going through, I believe she gets a chemo dose every 3 weeks. I think that's what it is. And she would have neuropathy afterwards. And, to her, it was a lifesaver because she could walk immediately same day following the treatments, where prior to that, she would lose basically all ambulation for several days. So we've seen it work in some pretty cool cases, unique cases. Is there anything else, Mark, that we're missing there that you're seeing it work really well? You mentioned, light use in PTSD, et cetera. Is there anything else that for therapists, podiatrists, functional med chiropractic care that you see clinicians using it for?
Yeah, so just piggybacking on the neuropathy example you just gave, we participated in a study just a couple of years ago with diabetic neuropathy, so different mechanism, but same peripheral neuropathy complaints, and used a graduated protocol using the laser to basically trace the path of the sole of the foot all the way up to the popliteal space, and then in treating the low back as well to try to get cell bodies involved at dorsal root ganglion. And had really nice results. We were looking at 3 specific biomarkers that were related to inflammation that are associated with peripheral neuropathy. And there was a significant change in one of those 3 with use of the laser, in addition to better function, better pain results, and things of that nature. So showing mechanistic differences, so pretty cool stuff. I think the thing is that the way it works for the peripheral nerve is that it improves blood flow to it, which is a number one thing that happens with the diabetic population. They have really poor blood flow to these nerves. One of the mechanisms is thought that sorbitol accumulates around the nerve, which is very toxic, and that with better blood flow, better oxygenation, it can actually get changed back to glucose and be absorbed into the system. So better growth factors, better axonal sprouting as a result of that for these peripheral nerve injuries, which can really help heal some of the pathology depending on how severe it is. I say that with an asterisk because if that person's diabetic, overall program is not being managed well with diet and their meds and things of that nature, the laser is not going to solve that. So in a well-formed program for those patients, adding that to the equation can really help maybe take them to a different place, which is exciting. So diabetic neuropathy is a huge problem in this country, and it's not going to go away. So most people in the clinic are trying to treat it with just doing, functional things with balance or possibly some, desensitization techniques or things, but they're really not getting at the heart of the pathology. So introducing a laser into that equation can help you really start to treat, the tissue that's involved, which is pretty cool. But to your latter question, I think the thing that's most confusing is that when you have a high power laser on your skin, you feel warmth. So, people go back to thinking about when they learned about modalities in school, and they go, well, if it's hot, you can't use it on something that's acute, want to use cold, right? So I spend a lot of time coaching folks up on that, because what you're really doing is just trying to accelerate metabolism. So it doesn't matter if it's acute or chronic, you can use it on both. It's just the dosing it changes, because the amount of energy you need to put into something that's acute is different than what you need to put into something that's chronic, which tends to be more. So once you get over that hurdle of like, I can treat something acute with a warming modality, you're halfway there. So I did a little case report on myself. I had a medial meniscus address last year, and it was my own little case study. So I didn't touch my knee with ice. I took Advil for, I believe, 2 to 3 days after the surgery. But I, of course, went against doctor's orders and ripped off all the dressings. Like, I'll leave it in place for a week. I was like, this is going to go today. So I stripped it all down so I could get exposed skin, and started treating my knee with my laser right out of the gate, and had significant reduction in my inflammation within, a day or two. I was walking around the afternoon of my surgery with minimal pain, and was walking around. No, I never had an assistive device during the entire thing, and was pretty much walking around, and was back at the gym within 3 days doing some basic stuff. So I wrote it up, and I provided the chat so we could check it out. But pictures don't lie. I took some pictures just to show, how it progressed, but it worked out pretty well.
Yep, awesome. So quick share on that one as well. I'm halfway to 90 now, just past my the mid 40s.
We're on the back 9 now.
yeah, exactly. So and I pretend like I should still be on the wrestling mat, going to grappling, jujitsu 3 mornings a week. I have no idea what I'm doing there, but I love it. And there are many times where shoulder, elbow, knee, hip, that I will come in on a Sunday evening and just do the same thing. Case study on myself, just to get the inflammation down so I can get out of bed Monday morning at 5:20. But completely with you there. So indications, you mentioned a few. The other one that I've seen that we have, who was it in here? um, something about it, I believe it was one of our team members. Their son had some sort of laceration, and I think they worked directly with you. I think one of our therapists worked directly with you. It was a year or two ago, and the healing rate was expedited tremendously. Just so, can you talk about that? The utilization there.
Yeah. So the more superficial the problem is, the easier it is for a laser to help it. So when you have like wound care, uh, some of the first research that was done with laser, and it's a lot of different types of lasers can help with that, because when you're dealing with stuff that's right on the surface of the skin, you just have to kind of be close and you'll get a good outcome with it. So yeah, super low power needed because you don't want to heat up that epithelial tissue because it can be damaged pretty easily. Um, but yeah, with minimal dose, you'll see significant changes in your post-op scarring and things of that nature. Treatments only usually last 20, 30 seconds, so they're very small for just the wound itself. But anyway, that's for you to decide how to handle that in the clinic as far as billing for that service. You know, when you're dealing with a post-op situation, you're going to be treating the entire joint to help with the inflammation, and then you're going to treat the incisions with a slightly different setting on the machine. But I think it's hard. I kind of jumping around, I know, as far as indications, and those are great questions, but like basically anything that's an itis or an osis in the body, you know, from a tendon, it's going to help that. Muscle strains, it's going to help that. Any kind of synovitis, it's going to help that. Neuritis is nerve pain type things. Any kind of pain situation that's got muscle guarding, spasm, things of that nature, it's going to help you with managing that. So it's a very broad tool. And the thing is, once you understand it and appreciate how it can be applied, it really has a place for almost every patient that walks in your door, you know. And I say that because I don't like leading with that, because as soon as you say that, people start rolling their eyes. They go, brother. But I mean, if you think about, you know, trying to treat pain and inflammation and soft tissue injuries, that's what most of us are doing, you know, with the majority of the people that we see. So
let's invert. What are the contraindications? When can't we use it?
yeah, so the biggies would be pregnant moms, you know, over their abdomen, low back, side joint area. You wouldn't want to do that. Active tumor for cancer. It can be used once they've, you know, are they deemed cancer free or they're going through chemo. There is, like your patient you had, you can use those folks with the, you know, being on the same team with the oncologist to make sure that everybody's on the same page and the patient understands, you know, the small amount of risks. They've done studies, they've put light on different metastatic type tumors, and it's shown that it didn't increase their the metastasis. So it's pretty well documented. But like for folks that have had breast cancers and they're having pain in their shoulder afterwards and limited range, it's been shown to really help with that type of problem, you know, sort of a secondary problem to those mastectomy patients and things of that nature. Lymphedema, you know, they're having swelling, treating the lymph nodes and things of that nature, and the better circulation helps with those patients as well. So you certainly can use it with post-cancer patients. It's just if you had somebody with a melanoma, you wouldn't want to go right after that, obviously. But growth plates for children, so distal long bones, you want to be careful. A little bit of a wives' tale as far as it, you know, they've never done a study that said, oh, if you treat over a growth plate, it's going to cause a life length problem, but that's sort of the fear of it. So you'd want to treat around that. It comes into play when you're dealing with Osgood-Schlatter's or Seaver syndromes. Those are the most common growth plate type issues with kids. So you wouldn't want to treat directly over those for that problem, but you could treat surrounding soft tissue inflammation that was related to it. Other than that, you can treat, the nice thing about laser, you can treat right over metal. So like if you have a total joint, it's not like ultrasound or some of the other, you know, magnetic type devices. You can't do it around metal. There's no problem with laser, just gonna, light's gonna bounce off of that. But we do recommend not treating over implanted stimulators or pacemakers, things of that nature. Again, if it's metal, it's probably going to bounce off of it, but the small chance that there was a dark lead wire or something that could possibly warm up, that would be the fear. And it's more of a CYA thing. You know, if something were to happen to that pump, you wouldn't want to be part of the story as to what might have caused it. So by just treating around that and avoiding that, you will be out of that discussion, which is recommended. But other than that, it's pretty much it. You know, I mean, you can treat it almost everybody with it, which is great.
I forgot about this story, but I had one adverse reaction ever, which was a wrist issue. And female patient, she had a tattoo on her wrist, and she started, it was kind of an odd response.
Mhm.
But she started jumping and I said, "What's going on for you?" And she said, "It feels like I'm getting shocked." And I said, "Okay, fair enough." And we stopped. Yeah, but so tattoos, my guess would be depending on. So is there any validity to that? What I experienced there?
Yes. So I think with the ink that's used, there's certain inks that have more metal content, and those will get hot really easily. So, and it's hard to say. I've heard like, oh, it's the old ink versus the new ink. I think there's just certain pigments that they use. There's more metal in it, so you have to be careful of that. Generally, it's just like anything dark. It's going to absorb more light. So you have to usually go with a little lower power, move a little bit faster over the space. We have a setting on the LightForce equipment that you can change the skin tone that changes our wavelength mix internally, which also helps with that problem. So if you know how to manage it, you can usually treat that. But there's still those folks that are just, they're too hypersensitive, especially in areas with high nerve density, like in a wrist or a hand. That's going to be even more challenging. And the one last thing for a contraindication I was going to mention is patients that are on photosensitive meds. Antibiotics are a biggie. So you want to ask your patients that because they'll be more at risk of having a reddish sunburn type reaction to the laser. So you'd want to take that into account and use lower power and make sure that the patient was aware of that risk. For kids, Accutane is another common one that you want to be aware of because that's the sensitizer as well.
Fair enough. It was definitely old ink, Mark.
Was it? Okay, got it.
Guarantee. As soon as you said it, I was like, oh, that makes a lot of sense. Because I remember like mentally, and I can still picture the tattoo. It was flower and it had leaves. Yeah. So anyhow, we're good there.
With a sagging flower.
Yeah. So I want to ask you some questions about Shockwave and its use with tendinopathy. Before we get into that, there's usually something that gets in the way with either laser or Shockwave. You talked about it before, and I want to do a deeper dive into it. And it's that clinicians, maybe minus the chiropractic community, in general, we suck at selling. Okay. Mm-hmm. And I'm not trying to sound dramatic, but I think it deserves attention because most of us are not, it feels awkward. I've watched it myself. I've been through it early in my career. And I know we've had owners, especially with LightForce, there was massive adoption of laser therapy within the breakthrough community and the physical therapy community in general. And can you talk about, I'm thinking about the Bocce method, which I know that you know. Can you think about ways that you've seen physical therapists or any clinician, frankly, adopt the laser technology, use it as a cash pay service in an insurance-based clinic, and where they had massive wide adoption and it was wildly successful? What were they doing? How do we do this? So if I'm listening to this, I don't have a laser, I don't have Shockwave, I want to add cash pay services. What are those clinicians doing? What are they saying in a way, in a presentation? How are they presenting it to the patient in a way that it doesn't feel too salesy?
Yeah, well, if you ask the average healthcare person about selling, they're going to remind you that sell is a 4-letter word. They hate it. They don't realize that any good clinician that has great compliance to their plans of care, there's salesmanship on the front end of that. You're selling yourself. That patient's sitting there looking you up and down going, does this person know what they're talking about? Are they going to be able to help me? Do they understand my problem, why I'm here, how much pain I'm in? Is what they're telling me, on how they're going to address this really hitting home? And I would argue, if you want to have a forecast on who's going to have a tough time selling a cash modality in your clinic, just look at your clinician in your practice that has the highest cancellation rate. If you want a key indicator on who's going to struggle, it's that person, because the person who has a high cancellation rate basically is not doing a great job connecting with their patient, and they're not engaging with them and really getting them bought into their plan of care, laser, no laser, whatever, just however they're going to help that person. So whenever I have to come into a practice and kind of assess and help owners out, that's usually the first question I ask: who's got your highest cancellation rate? And then the second question is, are they having trouble with the laser? And it's without fail, yeah, that's one of them. It's like, right. So that being said, I mean, the sort of the secret sauce in having a cash pay program, it's the device is important in getting outcomes, and that's certainly not to be belittled, but it really starts on day one. When you meet that patient, are you connecting with them? Are you listening to their story? Are you finding out what their goals are? And then are you incorporating your plan of care to address those? I mean, it's a big blind spot I used to have when I was treating patients. I was so confident with my own plan of care and my own problem list that I was just like, yeah. I know you're having problems, but if we take care of these magic 5 things that I found, then you're going to be great. But I'm sure I lost a lot of patients along the way because they didn't feel that I was listening to them. And I found later when I was treating patients that if I just slowed down and did a little better job of going, why are you here? What is it that you really want me to help you get to? And then tie that into my plan of care and sort of help connect the dots around what they really want to have happen. Everything worked out better. So that's the first key. You have to make sure that you understand why that person's there, because when you're talking about asking somebody for money on top of whatever the insurance is going to pay, now that person's looking at you with a much more critical eye. So knowing who's in front of you is important. So if you have a weekend warrior that maybe has a sprained strain or hurt their back, and they have an event that's coming up in a few weeks, well, okay, that person's going to be highly motivated to do everything and anything they can to make that goal happen within a small amount of time. So the conversation you're having with that person and how something like a laser or a shockwave is going to help them get there is different than if you have the guy who says, yeah, you know what, I'm only here because my wife made me come. I got this 3 out of 10 pain and I've had it forever. It'd be nice for it to go away, but it doesn't really limit me that much. I can do most of what I want to do. If you can help me, that's great. But if not, I'm not expecting miracles, right? That guy's got a whole different approach, right? I mean, so could the laser help that guy? Yes, but how you couch it or how you frame that discussion is going to be very different than the person that is trying to get ready for the race in 3 weeks. So I think knowing your target audience and who's in front of you is another key factor. And then, the last piece is just to make sure you have the right tools for the job. So if you have, all lasers are not equal, I think you've got a little bit of feel for that based on what we've talked about today. I mean, you could be a great clinician, and if you're putting something that doesn't have the capacity to change their pain today on that patient, well, you're going to have a lot harder time than maybe a mediocre person who has a device that can take pain away very quickly. And after they're done with the treatment, say, what do you think? Those discussions will be a lot easier for the person that has the thing that help bring their pain score down. So I think the thing, and we at LightForce have done a great job historically in helping give tools of education on how to do this. So you're not out there on your own trying to figure it out. We've got pretty much a recipe and a playbook and scripts on how to help your front desk all the way back to the therapist and the person who does the collecting at the front. So you don't have to figure it all out. We've pretty much done that for you. But the nice thing is that once you start getting things clicking and you understand this process, the nice thing is the demonstration of the laser, showing the person how it will work will pretty much sell itself. So you don't have to have this big campaign on the patient. And the thing we have to remind people is that you're just making your best recommendation for that patient. So as the therapist or the clinician, you're not saying, hey, you got to do this or I can't treat you. No, you're just saying, hey, if you were my mom, this is what I'd recommend, and you give them the best plan of care you possibly have in your back pocket. And maybe that includes some cash pay devices, and maybe it doesn't, but you're going to say, this is what I think is best for you. And if they go, great, then you're off to the races. If they go, well, that sounds okay, but I don't know if I can do that. Now you're going to have a discussion on why. And maybe you're recommending laser 3 times a week and they say, hey, I can't really afford that. Can we do it twice a week? Would that still work? Sure. We can make that work. It might not be the best for your acute problem, but it's good enough. And so, yeah, let's do that. But that's a discussion you're going to have. And the thing that I think most clinicians get caught up on is like, they get very scared of the fact that they're going to say something like, hey, I think you need to do X, Y, and Z, or do this thing for cash on top of that. And when the person balks at it or says, no, I don't know if I can do that, then all of a sudden the house is going to fall down. You are not telling them what to do. You're just recommending what to do. And it's a joint discussion, and once you come at it that way, it's like, hey, I'm the professional you came to see for some advice. I'm giving you my advice. Now do you want to take it? That's what makes it all go round and round. But the pitfall that I hear a lot of the people that struggle is they're so nervous about asking for $1 or $2 from a patient, they start turning it into, let me ask the patient what they should do. So you've probably all heard this from one of your newer therapists. Yeah, we have this new program. Do you want to give it a shot, or do you want to try it? And that kind of soft language. The analogy I give is if you went and saw your medical doctor because you had a sinus infection and you were looking for an antibiotic, and he looked at you and said, "You want to try some amoxicillin?" You'd probably run out the door, and rightly so, if they weren't confident on telling you what you needed for the problem that you came in for. So in rehab medicine, we should be doing the exact same thing as far as the exercise we're asking them to do, the supplements we're asking them to take, the treatments we're trying to provide. It's all prescriptive. And if you come from a prescriptive place that you're trying to work it out with the patient in front of you, it tends to work really, really well. But if you fall on a few of those other things we were talking about, probably won't.
Exactly. Yeah. To shed some color on that, I have 6 kids. 4 5 for 5 so far in needing orthodontic work. They have a case presenter. So we go in for the x-rays, all the imaging, the diagnostic stuff. Then they do a case presentation at the next visit. They're frequently asking for $5,000 to $6,000 a case. And there is here's what successful treatment looks like. And I basically think of them as a guide, just walking me through. And I see, hundreds of other patients that I can see through there have done the same exact thing, if not thousands, right? And I think, and if you're okay with it, I'd love to share what Bob Bocci had shared on stage at the events.
Sure.
In terms of rolling out LightForce. He did the trial. I believe you called it a demo. Quick disclaimer, you're going to want to check your, legalities in your state, your practice act, everything else about what you're allowed to do and not to do. Don't violate your insurance contracts, everything else. So we, or Bob shared what they would do as a trial, and this is what our group adopted as well, but a trial of the laser. So first visit is eval, usually some sort of manual therapy, any other modalities that were going to be in there, and then exercise. So the patient has that experience. On visit 2, they schedule a trial of laser to augment the treatment. And then in visit 3, Bob and his therapist would say, okay, now Mark, you've had treatment without laser on visit 1. You've had treatment with laser. Which one would you prefer? And the patient says, well, I felt a lot better after visit 2. That's what I want. And then he would say, okay, here's the packages. I recommend, package. We sell basically a good, better, best, a $400 package, a $800 package, and a $1,200 package, roughly. Which one do you prefer? I recommend B based on, what's going on with your shoulder. How do you want to handle that? Right. And that's what, again, we jokingly called it the Bocci method because it worked for quite a few therapists. So we adopted that. It worked very well. Is that pretty much in line with what you've seen work for clinicians?
Yeah, there's different flavors of it. And I think the one thing you pointed out, and it's a word that sometimes goes by quickly, but just to make sure you heard it, is you recommend something with some basis to it. So if you say, hey, I think you need a package of 6 visits, you need to have the why for that patient. And you just say, hey, if you came in 10 days after an injury, you're right on the cusp of getting out of the inflammation phase. I really want to get you well into tissue healing and out of pain so that we can really push your program. That's going to take 2 treatments a week for 3 weeks to really get you where you need to be so that you can start to do the more resistive stuff that you'll need to get back to fill in the blank for their goal. If you explain it that way, like why you're expecting them to do 6 visits or even 10, like if, hey, you have diabetic neuropathy, this is going to be something that might require 20 visits, over the span of months because of the nature of that pathology. If you put the explanation down and they get it and they see some result, you'd be surprised what people will come out of their pocket. I saw, it was a breakthrough clinic, actually. One of the early installs I did, they had a patient that had a really horrible experience with a couple knee revisions and was sort of just struggling to get about 70 degrees of knee flexion. And they had done everything under the sun to try to help this person out. And we're just sort of like, hey, we're stuck. This is the best we can get. Very nice lady. And they treated her with the laser, and she picked up about maybe 8 to 10 degrees of flexion, which for most of you would go, But you have to understand, they were working with this lady for months trying to get range, and they couldn't move the needle. And she picked up 8 degrees within 5 minutes. And she just said, here's my credit card. I'll take 20 visits because this is the best I've felt in months. So, I mean, not a single conversation about a package or whatever, just was like, I want to do this because it's helped. So it can be that dramatic. I'll share with you guys the best practice that I've heard with the how to do this demonstration business with the laser. And it came from a very successful podiatrist in Newport Beach that uses our equipment. And the way he does it is he refers to it as a risk-free trial, meaning that you're not giving away the treatment for that first day. You're just saying, hey, I'm going to do this treatment. I'm so confident it's going to help you. If you don't like it or you think it didn't do anything, then it's on me. So you as a practitioner are going to assume the risk. You're going to say, I'll take the hit if you don't want to do this when you come back on day 2. But if you come back on day 2, which I'm guessing you're going to, and tell me how much better you feel because of this, we'll get a package of this in your program. And today was the first visit. So the nice thing is that you're capturing revenue for that first day, but at the same time, the patient has basically got a 100% risk-free guarantee that, if they don't like it, there's nothing extra to the visit as far as the laser goes. So every clinic I've talked to with that strategy has loved it and run with it and done really well. No, I don't know too many patients that are going to get upset with you for giving them a guaranteed treatment that if they don't like it, it's no charge. So
great. So when I ask you about Shockwave, that is new to me. So what? Same idea there that we went through laser. How does it work? Let's start there. How does it work?
Yeah. Yep. So what's interesting, not alone. I mean, in the international PT community, Shockwave, very, very common, almost standard practice. US PT, people barely heard of it, right? So it's just starting to get some legs here in the United States. But the general deal is that think of it as an ultrasound on steroids. So it's about 1,000 times more powerful wave. And it's basically a really sharp positive that's followed by a quick negative pulse. And it has the ability to make cavitation happen in cells. So just imagine you're putting sound waves on tissue or a cell that's damaged. It shakes it up really well. And in doing so, if the membrane can't sustain it, it's going to basically cause that cell to die, which will then cause the body to come in and replace it, gobble it up with macrophages, and start laying down new tissue. For those cells that can withstand it, it causes increased activity in the cell as well, because it's pulling on different proteins and things in the cell that have the ability to impact the nucleus and what have you. So it's been shown to increase fibroblastic activity and growth factors and things of that nature, increase blood flow. Basically, it's a pro-inflammatory modality. So you're causing some low-level inflammation that basically is going to restart the inflammatory process. So for those folks that are out there grafting people and really rubbing hard on tendons, or they're using dry needle equipment to pepper a tendon to cause it to bleed, guess what? You're trying to do the exact same thing as this is doing, except it's much more elegant in how it goes about it. So think of it as you're stirring up something that's had, a recalcitrant, tendinosis, like in an elbow, a tennis elbow. The person came in and say, I've had this for 5-6 months, right? We know how hard those patients are to deal with. What this is going to do, in addition to your eccentrics and range of motion and soft tissue work you might do, it's going to cause that tendon that is now most likely a degenerative tendinopathy to get possibly some better angiogenesis, get some better blood flow to it, get new collagen to lay down from the tenocytes and the tenoblasts, which otherwise probably wouldn't happen. Maybe you could make it happen with your Graston technique or peppering it, but some people don't like getting needles stuck in their elbow. The thing about it is that it differs from the laser in that it generally isn't one of those things you do and they go, oh, that took my pain away, it feels great. It's generally a little uncomfortable while it's going on because you're finding a spot. Like imagine you have any kind of tendinopathy and you push on it, right? You're basically pinging away on that sore spot. So there's a little bit of grin and bear it for about a minute and a half usually, until you get some adoption that takes place. Some of those central pathways with descending, inhibition will kick in, and all of a sudden the patient will go, yeah, it doesn't feel so bad. and it's one of those that kind of like it hurts so good. So for people that have had a chronic thing, and I'll use myself as an example. Again, I had the knee surgery last year wasn't enough, so I figured I'd go in and get my shoulder done too because I needed a decompression. And so December, they hacked off the end of my collarbone, and I was using laser to treat that, and it was doing well. My range was pretty good, but 2 months out, they really had moved around and scraped my bicipital tendon. I begged the orthopedic surgeon not to clip it. I was like, unless it looks horrendous, please leave it alone. I want my original equipment in there. And he was like, well, okay, so he left it alone, but he didn't tell me. I had to read the surgical report. He really like scraped it a lot to try to get some blood flow to come into it. And I was like, why is it so sore? And then I read the report. I was like, oh, of course. Right? But I was treating it with the laser, and the spot on the posterior aspect of the collarbone where they had done the cutting, there was a spot in there that was really sore too. And the laser just didn't seem to resolve it. And I just used my radial pressure wave over the bicipital groove. And then back here, it was about 4 or 5 treatments total over a few weeks. And it took care of it, like haven't had any pain or problems or us, with that stuff since. So the thing about this sound wave technology is that sound waves go through tissue a lot easier than light. So your ability to reach depth with these devices is much easier. And the place where they really shine is in recalcitrant tendinopathy. So if you had a degenerative tendinopathy or something that's very long, that's been around for quite a while, so plantar fasciitis, heel pain, those types of patients that we know are so hard to address, Achilles tendinopathies that have been around for quite a while, this is the device that can really help turn that around, because you're basically just invigorating the healing process to restart. And there's lots of research to support chronic tendinopathy with this technology. So it's good stuff as far as having another bullet in your gun.
Great. Any other indications or contraindications for Shockwave, Mark?
They're very similar to the laser. Believe it or not, the one difference is you can't treat around cemented joints with that device because they don't want it to, possibly loosen it up. So if you have a total joint, you wouldn't want to be using, Shockwave around it. But same thing with growth plates, you want to be careful around that. Active cancer, things of that nature. But there are some indications if you're using super high powered, like focused shockwave around lung fields, to try to avoid that. But if you're in the more modest ranges, that's generally not a big deal. You just try to angle treatments away from those to accommodate. So.
Okay, and the dosage with regards to time is similar, 5 to 10 minutes or so?
Yeah, so it sort of depends on the equipment you have. There's sort of 2 general families in the shockwave world. There's the focus shockwave, which is a convergent wave, and the nature of just the head that creates that pulse, it's a very slow frequency. So like the product that we have with Chattanooga, the highest frequency is at 8 hertz. Whereas the radial pressure wave is a different mechanism and it can go a lot quicker. It's a divergent wave, so that it's the way that it interacts with tissue is a little bit different. So dosing is a little bit different, but those treatments are faster because you can go up to 21 hertz with that. So when you look at the dosing literature, basically you're going to be providing somewhere between 1,000 to 2,000 pulses per treatment per spot. So you can use it on trigger spots as well as the primary tendinopathy, but you figure you're probably going to be treating 2 or 3 spots in a given treatment. So the faster that you can produce the burst of energy, the quicker those treatments will be. So depending on which equipment you have, it could take a little bit longer than the other. But yeah, I mean, generally you're probably looking at about 2 to 3 minutes a spot on average. So if you're treating a couple spots, you're probably 10 to 15 minutes per treatment would be about the norm.
Okay. For owners that are looking to investigate, or they want to take a look at either the LightForce laser or the shockwave therapies, what's the best way for them to get in contact with you and your group?
Yeah, so the nice thing is we have a whole bunch of websites right now that are in the process of getting married together. But if you go to lightforcemedical.com, you can go there, request a demo or information. That's an easy way to get hooked up. You can also go to the Chattanooga websites or even the DJO ones. There's all ways to kind of channel back, but probably, believe it or not, the most direct way is just go to lightforcemedical.com and request a demo, and that'll get.
Great. The other thing that I wanted to say, which I think is super important, is many times as owners we go to an event, we go to a conference, we buy a piece of equipment, and then I've talked with so many owners that, now they have a piece of equipment over in the corner that they store the hot pack covers on. They use it as a drying rack. And I know you and your team, you've traveled. I've been lucky enough where you've traveled here to Harrisburg, Pennsylvania, the destination capital of the world, right?
Who wouldn't want to come to Harrisburg? I mean, come on.
And I think you've been here more than once too, Mark. So I greatly appreciate that.
Love the place.
Yeah, special place in my heart just for you for being here, because I know it's a rough spot to get to. Nonetheless, you and your team do a beautiful job onboarding, making sure that clinicians are comfortable. They understand, everything from a science perspective with regards to dosage and utilization, et cetera. I think you even do a certification, right?
Mm-hmm. Yeah, so when you do the training, you will get certified, for that training session. So you'll get a nice certificate you can put up on the wall, frame it, have mom sign it, but yeah, for sure. And the nice thing is that we're trying, to sort of grow our bag of things that we can help you out with. So for those of you that want to hear about laser, no problem. But if you're interested in hearing about Shockwave, we can do that at the same visit and show you what that's about and demo that for you. And then if you're just looking for just general stuff that you need to upgrade the clinic with, maybe a new high-low table or a hydroactivator or what have you, we got that whole line of stuff too. So we really are trying to help promote the fact that we can help you on a lot of different ends of, from the most basic needs for your clinic to the more technological side of things. And that's where myself and my team is entrenched, is to help make sure that you guys understand it, know how to apply it, give you the research you need to help make your staff comfortable with understanding it, so that you can knock it out of the park with your patients and your outcomes.
Awesome. Mark Callanen, so on behalf selfishly of my private practice group, I know we've benefited tremendously from working with you. So thank you for everything you do. I know many other breakthrough owners as well have benefited from their relationship with LightForce and Chattanooga and Don Joy as well. So thanks for everything you do, Mark.
Yeah, and I throw it back to you, the work that you guys are doing to help private practice, bob and weave and survive in those troubled waters out there. I mean, the information you're providing to the breakthrough community is invaluable. So, thanks so much for helping out as many private practices as you are. All we can do to help with bolstering the message, we're here side by side to do it, and happy to do it.
Thank you, sir. And thank you to everybody listening, and we will see you on the next episode. See ya.
Thanks.
Remember to visit getbreakthrough.com to access our free resource library designed specifically for private practice growth. While you're there, make sure you register for a complimentary growth assessment to learn about potential opportunities for growth in your local market. Again, thank you for tuning into the Grow Your Practice podcast and supporting our mission to help people in pain get back to normal naturally.